See, chemotherapy is a group of drugs which has evolved over time, and initially chemotherapy drugs were very less. I would say around 40 years back, we had only three or four drugs to treat patients. So these kind of drugs initially they were made from the bark of trees or some plants, some oils. So these kind of drugs were purified from the tree bark or some elements like that. Nowadays, we have come a long way, and these drugs now are prepared synthetically, and we have around 2000 more drugs or 2000 new treatment in last 30 to 40 years. So we have come a very long way, and these chemotherapy drugs, they are sometimes those antibiotics which are found to be effective in cancer treatment. So now they are called chemotherapy. So the notion that chemotherapy is something else, it has come from the another planet, it is not so. So these are the drugs which are found effective in the cancer treatment. That is why they are called chemotherapy. Antibiotics is also a chemotherapy.
Right.
So chemotherapy is nothing. Chemical plus therapy is chemotherapy. So chemotherapy, these drugs are to be given via oral route or mostly these are injectables. So these drugs, they actually cause cancer cells to die. At the same time, they also cause side effects because in general, the principle behind chemotherapy is that they kill the cells which are very rapidly dividing. So cancer is a very rapidly dividing group of cells. So if they cause cancer cells to die, so they don't differentiate between the normal cells and cancer cells. But the effect on cancer cell system were permanent, and body cells is temporary. So rapidly dividing cells in our body system are the hair follicles, lining of the mouth, intestinal lining, skin sometimes. So these cells are also affected. That is why during chemotherapy, patients have side effects of hair loss or mouth ulcers or diarrhea. Like these side effects are there. But nowadays, we know each and everything about chemotherapy, how to tackle those side effects, and proper treatment of those side effects. So nowadays, patients are very much safe with chemotherapy. If the doctor is knowledgeable enough, then these side effects can be minimized. Hormone therapy is again use of hormones in the treatment of cancers like prostate cancer, because these cancers grow on hormone. So you cut the hormone supply by another hormone or some other therapies which reduce the supply of those chemicals or hormones to the cancer. That is how you halt the progress of the cancer. So in breast cancer also, breast cancer is majorly three types: estrogen receptor positive or triple negative or HER2 positive. So if we cut the supply of estrogen receptor positive breast cancer, we can get very good results. We can stop the progression of the cancer. So similarly, in some cancers, we use hormones also. So this is hormonal therapy. Nowadays, people are talking about immunotherapy very much. It is a very hot topic.
Yes, sir.
So
yes.
Immunotherapy is nothing but these drugs which causes our immunity to work efficiently. So whenever cancer is there, it actually modifies our immune system in such a way that immune cells, which are our own cells, our own defense against cancer or other pathogens, it cannot work properly because cancer secretes some things which actually put a brakes on immune system. So these drugs, they go and trap those chemicals secreted by cancers, which causes immune system to stop working on cancer cells. So it is a anti-braking system, immunotherapy. So that if those brakes are released, our immune system cells can go and attack cancer very efficiently. So these are immunotherapy drugs. But nowadays, immunotherapy drugs are in research. Not every cancer has treatment by immunotherapy, but some cancers like head and neck cancers, mouth cancers, lung cancer, kidney cancer, liver cancers, these kind of cancers, they have immunotherapy options. But not every other cancer has immunotherapy options. It is still evolving. So this is immunotherapy and it has got good results, but still people actually think that immunotherapy will cure them. So immunotherapy has not evolved so much that it will cure stage 4 patient or very advanced cases. No. In such cases, still first line is chemotherapy. Immunotherapy comes next. But as the time will pass, I think we'll use it in more cancers.